Hi, I'm going to talk a little bit about sexual violence and reproductive control in South Asia. As you can see from the slide, South Asia is disproportionately affected by gender-based violence from the form of both sexual violence from non-partners, but in particular partner violence, intimate partner violence. A WHO report indicates that 42% of 15 to 49-year-olds in the region have experienced partner violence. We are particularly interested in starting to think more about sexual violence. There are indications that it is on the rise in the U.S. In fact, in India alone, best estimates for a paper that we actually published earlier this month found that 27.5 million females, 15 to 49, have been victims of sexual violence. About 1% of these report this violence to the police, and this is in no small part to the fact that there is no criminal, that rape in marriage is not considered a crime in India, and the vast majority of sexual violence that occurs happens in the context of marriage in the region. I'm not going to go through this in detail, but as you can see, similar to what's been discussed earlier, we have increased risk. Regionally, we see an increased risk for unwanted pregnancy, unhealthy pregnancy, pregnancy termination, and under 5 child mortality as a consequence of intimate partner violence. Interestingly, in the region, there have been mixed findings with regard to contraception, which would help these outcomes, obviously. And those mixed findings suggest in some cases partner violence increases risk for non-use of contraception, and in other studies we've seen that partner violence actually is associated with greater likelihood of contraception. So what we were interested in doing was understanding this a little bit better, because what we thought may be the case was that there was a collapse of the types of contraception. We were seeing different outcomes by different countries, and it may be that the different forms of contraception used in the different countries may explain these different findings. So we looked at the associations between physical and sexual spousal violence and contraception use using DHS data from Bangladesh, Nepal, and India. We focused on those the most recent data with both physical and sexual violence data available. And we included 2 sets of analyses. One was on not currently pregnant women to understand current contraception use, but also in the context of pregnant women, what was the trajectory from contraception to pregnancy? And so here are the findings. So with regard to the spousal violence and current contraception, you can see that actually physical partner violence did not predict contraception, but sexual partner violence did. It was associated with an increased likelihood of the use of modern spacing and a decreased likelihood of use of sterilization. I have to bring up the fact that having sons was the strongest predictor of modern spacing contraception other than wealth. And it really speaks to, within the region, the relevance of having contraception, of sons as a decision maker for contraception. Similarly, we found that sexual IPV in the context of pregnant women was associated with both traditional and modern use of pre-pregnancy contraception. We also found that it was not associated, sexual violence was not associated with unwanted pregnancy with the same population, with the same sample. And when we thought, well, why is it that they're more likely to use contraception pre-pregnancy, but there's no reduced likelihood of unwanted pregnancy? If you looked more carefully, we found that sexual violence was also associated with greater likelihood of contraception failure, and we think that that's really at the heart of this. Again, having sons was a significant predictor, and it was the strongest predictor of contraception in this population. Most sexual violence in South Asia is in the context of marriage, and it's not criminalized. Victims of marital sexual violence are more likely to use contraception, but also more likely to have contraceptive failure. It's entirely possible that it's due to reproductive coercion. We are now looking at research to try to understand that better. And this fact that it's associated with the contraceptive failure may explain why there are indications that there either is greater effect on unintended pregnancy or no effect. Quality family planning services must include consideration of marital sexual violence. That has to include support of reducing contraceptive failure, and we have to prioritize gender equity efforts to reduce son preference if we want to have any impact on improving contraception use in this region. Thank you so much.